Bismillahirrahmanirrahim. We'll be discussing a serious maternal emergency known as the hemorrhage. Now, hemorrhage is divided upon time duration. If the bleeding in a pregnant woman occurs between the 20th week till the time of delivery, it is known as antepartum hemorrhage. But if the bleeding occurs after delivery, it is known as postpartum hemorrhage. The most probable causes of antepartum hemorrhage are placental causes, which includes the placenta previa, Vasa previa, and placental abruption. This will be explained in the subsequent slides, whereas the local causes include the cervicitis, which is cervical infection, cervical ectropion, which is abnormal growth in the cervix, cervical cancers, vaginal trauma, and vaginal infections, which are self-explanatory. Now, moving to Vasa previa. Vasa previa is a condition that affects the fetus life. In this condition, what happens is fetal vessels transverse over the internal os. Now, whenever there is spontaneous or artificial rupture, these vessels bleed out. This results in fresh blood and there is painless bleeding. Whereas in placenta previa, which affects the mother the most, mother's life, in this condition, what happens is the placenta is over the internal os. Now, this is divided into three more other types: placenta accreta, placenta increta, in which the placenta invaginates up to the myometrium, and percreta, which is invaginates up to the perimetrium. Now, this results in due to various risk factors that includes the multiple gestations, previous C-sections, uterine structure anomaly, or assisted conception. Moving towards placental abruption. This is a premature separation of the uterus. This is due to defective trophoblastic invasion or other causes that includes direct abdominal trauma, high parity, uterine overdistension, sudden decompression of the uterus, and even hypertension. Now, antepartum hemorrhage can be diagnosed by clinical presentation that includes abdominal pain, vaginal bleeding, uterine contraction, increased bleeding that results in maternal shock. Now, the presentation depends upon the various types that are causing this hemorrhage. It is not only dependent that the patient will come to you with these findings. The findings depend upon the basic cause. Now, upon abdominal palpation, when this antepartum hemorrhage has occurred, there will be tenderness and the uterus will be tense. It would have a woody feel and the fetus will be difficult to palpate. This is also known as curvilinear uterus. This is due to increased amount of blood that is being present inside the uterus. Now, the CTG will show irregular patterning that will indicate fetal hypoxia, and this will also result in preterm delivery, or also known as miscarriage, and even the baby will be delivered prematurely, will be premature, or even there will be stillbirth. Now, the effects of placental abruption includes hypovolemia in the mother due to excessive bleeding, and disseminated intracoagulation due to endothelial damage that can also be life-threatening for the mother, acute renal failure due to poor perfusion, prenatal morbidities, fetal growth restriction due to decreased nutrition because the baby is born prematurely, and fetal-maternal hemorrhage. Now, treatment of such condition is that if there is small amount the mother presents with small degree of rupture or small amount of bleeding, we need to manage such a patient conservatively, and we need to observe by uterine ultrasound, and we need to see if fetal growth by CTG. CTG is cardiotopograph Doppler. So in order to see the patency of the vessels that are being supplied to the baby. If there is a large degree of bleeding, that we need to resuscitate the patient, and by hemorrhagic protocol, by giving the patient lots of fluid and trying to prevent further bleeding from occurring. But if there is severe amount of bleeding and the mother presents to us with shock, we need to immediately deliver the